Today's Consumer Investigation continues our examination of Waterview Heights Nursing Home. I've brought you a number of investigations about allegations of severe understaffing. Now residents and staff are raising concerns about the building itself, saying the maintenance needs of the almost century-old building make living and working there incredibly challenging. Visitors may immediately sense there's a problem when approaching the main entrance of Waterview Heights Nursing Home. It's blocked with large mounds of snow. That's because the company that owns Waterview Heights, the Grand Healthcare System, no longer owns this plot of land, nor Waterview's own parking lot. Those plots were sold last month at a foreclosure auction because the Grand failed to pay the taxes. While public records indicate the company does pay taxes on the building, residents say this nursing home, built in 1930, is certainly showing its age. And resident Johnny Levert says problems are constant.
There are water fountain, it's an ice machine thing that's full of mold and mildew.
As well as elevators, staff say, that work only sporadically. And then there's the HVAC system. When you called me on Saturday, it was 21 degrees outside, and
right.
You didn't have heat. What was it like in your room?
Oh, it was freezing in there. I slept with I slept with an entire sweatsuit on, sweatpants, hooded sweatshirt, all that.
Johnny says he was sent to Waterview Heights for rehabilitation following his knee replacement surgery. I'm interviewing him by phone because Waterview administrators refused to let me in, despite the fact that New York's Department of Health mandates that residents be given the right to receive visitors of their choosing at the time of their choosing. I've tried to visit Johnny twice. The second time was during that weekend he told me he had no heat. I'm waiting right now in the lobby. I was told that the receptionists were told not to let me in. So an administrator was called, and I'm waiting for him or her to show up. I waited for about 5 minutes, but like my last visit, the lobby is as far as I could get. I'm standing outside Waterview Heights again. I was kicked out again, and I was told that their attorneys would be calling me. Their attorneys did not call me. The Grand's executives didn't call me either, despite my repeated questions by email and text. I wanted to know whether the company is having financial problems. After all, last year the Department of Justice ordered the Grand to pay a fine of $21.3 million for billing Medicare for services that were never rendered. According to the DOJ, the fraudulent billing occurred at 12 nursing homes from 2014 to 2019, before the company bought Waterview Heights in 2022. As for Johnny, he's even more motivated to walk again so he can walk out.
I want to give myself another week and a half tops, and I know I'm going to be ready.
Now, before placing a loved one in a nursing home, it's really important to do your research. The Centers for Medicare and Medicaid rate nursing homes, and the State Department of Health makes inspection reports public. I have links to both in the bodies of my investigations on our website. That's WHEC.com.